5 types of headaches. What kind of headache is it? It's important to figure out what type of headache is causing your pain. If you know your headache type, you can treat it correctly. In one 2004 study, 80% of people who had a recent history of self-described or doctor-diagnosed sinus headache, but no signs of sinus infection, actually met the criteria for migraine. Here are some tips that will put a name to your pain. Tension headaches. Tension headaches, the most common type, feel like a constant ache or pressure around the head, especially at the temples or back of the head and neck. Not as severe as migraines, they don't usually cause nausea or vomiting, and they rarely halt daily activities. Over-the-counter treatments, such as aspirin, ibuprofen, or acetaminophen, Tylenol, are usually sufficient to treat them. Experts believe these may be caused by the contraction of neck and scalp muscles, including in response to stress, and possibly changes in brain chemicals. Cluster headaches, which affect more men than women, are recurring headaches that occur in groups or cycles. They appear suddenly and are characterized by severe, debilitating pain on one side of the head, and are often accompanied by a watery eye and nasal congestion or a runny nose on the same side of the face. During an attack, people often feel restless and unable to get comfortable. They are unlikely to lie down, as someone with a migraine might. The cause of cluster headaches is unknown, but there may be a genetic component. There's no cure, but medication can cut the frequency and duration. Sinus headaches. When a sinus becomes inflamed, often due to an infection, it can cause pain. It usually comes with a fever and can be diagnosed by symptoms or the presence of pus viewed through a fiber optic scope. Headaches due to sinus infection can be treated with antibiotics, as well as antihistamines or decongestants. To learn more about sinus infections, take our sinus infection quiz. Rebound headaches. Overuse of painkillers for headaches can, ironically, lead to rebound headaches. Culprits include over-the-counter medications like aspirin, acetaminophen, Tylenol, or ibuprofen, Motrin, Advil, as well as prescription drugs. One theory is that too much medication can cause the brain to shift into an excited state, triggering more headaches. Another is that rebound headaches are a symptom of withdrawal as the level of medicine drops in the bloodstream. Migraine headaches. Migraines can run in families and are diagnosed using certain criteria. 1. At least 5 previous episodes of headaches. 2. Lasting between 472 hours. 3. At least 2 out of these 4, one-sided pain, throbbing pain, moderate to severe pain, and pain that interferes with, is worsened by, or prohibits routine activity. 4. At least one associated feature, nausea and or vomiting, or, if those are not present, then sensitivity to light and sound. A migraine may be foreshadowed by aura, such as visual distortions or hand numbness. About 15% to 20% of people with migraines experience these.